Hello, everyone. Welcome to the Alzheimer's Association ALZ Talk on navigating dementia care. I am Monica Marino. I'm Senior Director for Dementia Care Navigation at the association, where our mission is to lead the way to end Alzheimer's and all other dementia, and that is through accelerating global research, driving risk reduction and early detection, and maximizing quality and evidence-based care and support. Our ALZ Talks provide education, information, news, and resources on a variety of different dementia and caregiving topics. And this webinar series is supported by Procter Gamble and is organized and arranged through the Alzheimer's Association. I am really pleased today to have two great guests with us. First is Kate Poseen, who is a professor at the University of California in San Francisco and the Global Brain Health Institute. And then we also have today with us Paula Blanchard, who is a dementia care practitioner and a dementia care navigator for Ripple Care. Welcome both of you to our ALZ Talks. Now, I've been with the Alzheimer's Association for just a little over 20 years, and sadly, and I'm sure that this has been your experience as well, in my work with families who have been given a diagnosis of Alzheimer's or another dementia, many of them have reported that upon receiving this diagnosis, they're really not given any guidance of what to do next or even what this diagnosis is and what do they need to start doing to plan for the future. And so they're left on their own to kind of figure it out on their own. For many families, I know caregivers will go to the internet, they Google the diagnosis, and there they are overwhelmed with the amount of information and they don't know who the trusted resource is. I know for myself, as working for the association, when I talk to families and community and they hear who I work for and they learn about what we do, how many times have people said, I wish I knew the Alzheimer's Association or the organizations and communities who are able to help families when their father, grandparent had Alzheimer's disease or another form of dementia. And we really want to be able to change this experience for our families after given a diagnosis and really make sure that they're provided with the guidance and direction that they need to in order to live the best life that they possibly can for as long as they can. And so I really want to make sure that as we talk about dementia care navigation, and Kate, I'm going to direct this question to you. Can you explain what dementia care navigation is? I know care navigation is not new, but dementia care navigation is.
Mm-hmm. Thank you so much, Monica. My experience has been the same with the many families that I've worked with, that following diagnosis, oftentimes families are left on their own to figure out how to manage and navigate this challenging disease. And the challenges, they evolve over the course of the disease too. So even once you think you've gotten things figured out, then some new challenges emerge with new symptoms, for example, or functional loss. So care navigation in dementia is designed to help address that huge gap that our health systems have historically not been designed to meet. So in dementia care navigation, after diagnosis, a family is connected with a care navigator. Now, this could be a social worker or a nurse, but more and more often, it's actually an unlicensed but well-trained and well-supported and supervised care navigator. Someone this is their role, their career, their job that they've stepped into to support families through this journey. So I think of a dementia care navigator as a guide who partners with their caseload of families, builds a relationship with them, gets to know their personal situation and care needs, and is available to them to help them plan ahead for the challenges of dementia and also respond to, whatever's coming up for them around the dementia care, always prioritizing the needs of the family first. Typically, care navigators will meet with the family about once a month, but that dosage, I think, should be tailored depending on the family's needs and their situation at the time, but usually about once a month. And the care can be provided over the phone or teleconference, but I find most caregivers just really like that opportunity to connect with their care navigator over the phone about monthly to talk about the challenges they're facing around dementia and help them get more support and education and plan ahead.
Kate, I know UCSF offers dementia care navigation, and in your experience being in the field, what difference have you seen that dementia care navigation can really make in the lives of not only the person living with dementia, but their caregivers? Because we recognize, right, that caregivers play such an important role, especially as dementia progresses or Alzheimer's progresses, and more of that caregiving responsibility falls on the caregiver.
Absolutely important question. So in dementia, I think as a healthcare provider, you need to think about both the person with dementia and the caregiver as your patients. You need to help both of them. Caregivers shoulder enormous burdens in dementia. They shoulder most of the burdens, right? In that day-to-day care and the emotional and the physical stress of caregiving. And in fact, if that caregiver is more stressed or is depressed, the person with dementia has higher healthcare costs. They will use the hospital and the emergency department more because that caregiver is not supported psychologically and, in preparing for their needs. And so they enter into this cycle of crisis-oriented care. So there's good reasons to support the caregiver, both because the caregiver needs the support, but also because that will reduce healthcare costs for the person with dementia. You're helping the person with dementia by helping the caregiver. So in our research, we have designed a model of dementia care that's called the care ecosystem that has dementia care navigation at the core. And we have found in this model of care that providing this care navigation with this dementia expert team, it improves outcomes for the caregiver. It reduces their depression and their burden. It improves outcomes for the person with dementia, improves their quality of life. It also reduces their emergency room visits. It reduces the use of potentially inappropriate medications. In other words, going straight to, say, an antipsychotic medication to treat behavioral symptoms rather than looking for maybe a change to the environment or the strategy that's being used. So we reduce the use of those medications that are really can be not ideal in dementia, and actually providing this supportive care to the family reduces total cost to Medicare. So it's actually Medicare will save money when we provide this type of care that supports patients and families. So frankly, everyone in that ecosystem of dementia wins with this type of care.
Right. And that type of care really focuses on the person living with dementia and the caregiver kind of really at the core, right, of everything that we do in order to best support them and enhance their quality of life.
Thank you. Absolutely.
Now, I know the Center for Medicare and Medicaid Services, also known as CMS, recently, well, about a year ago, launched the Guiding and Improved Dementia Experience, otherwise known as GUIDE, the GUIDE model. And I know that this is new for a lot of the audience that's listening in right now. And can you talk a little bit about what GUIDE is and the types of services that this model provides?
Yes, I have to say it was one of the happiest days in my career when I heard CMS announce the guide model in July of 2023. And it went live just this past July 2024. And it really reflects this national movement towards trying to make dementia care navigation more broadly accessible. The guide model is based on programs like the care ecosystem and other programs that have been shown to benefit people with dementia and their families. And health systems or community-based organizations that provide guide provide the services that you see listed here. So all of the participating programs like UCSF, like you'll hear from Ripple in a moment, they provide 24/7 access to someone on the clinical team. So if there's an issue that arises like wandering in the night, you can call them first. Care coordination and transitional care management, which is so important as over half of people with dementia have multiple comorbid conditions. And so often we find that specialty care is siloed. We need that coordination of care in dementia. Educating and supporting the caregiver, of course, is central to the model as we've discussed. This is the first payment model from Medicare that places such a high priority on supporting the caregiver. Care planning, so a comprehensive care plan must be generated when a new family enrolls in the program and then regularly updated about annually. There's a home visit that's part of this model. And then Medicare medication management and reconciliation, which I think is fantastic. We need somebody to take a comprehensive look at the medications and also think about non-pharmacologic approaches for behavior first. And yeah, and of course, connecting with community resources is so important. Families need to know, what is out there in terms of social services and support and respite and be able to connect with that. There actually is a small respite payment for caregivers as well. So I think it's $2,500 a year. And so the programs that are administering GUIDE will also arrange to have that amount of money towards respite services to give caregivers a chance to take care of some things like maybe their own health, go to the doctor, for example.
Yeah.
So that's what it includes. It's a very comprehensive program that thinks about the person with dementia and thinks about the caregiver too.
Yeah, that is a great list of services that are offered through these guide model programs that are going to be launching across the country over the next year. I know that there are around 96 or 97 that launched July 1st of this year, and there's almost 300 that are getting ready to launch July 1st of 2025. So I know some in our audience are probably biting at the bit and wanting to know where to go, and we'll talk a little bit about that later. But really, just a great movement, as you said, from where we were before, where families were really had no access to dementia care navigation, or very few families had access to that, and then to have it be covered under Medicare. So I do know people are probably asking, well, who's eligible for the GUIDE program? And I know that there's a whole litany of eligibility that CMS actually developed, but just, high level, Kate, I know people living with Alzheimer's and dementia who are on traditional Medicare AB, which means that it's their primary insurer for their health care. And those individuals may be eligible to actually receive this type of program, this navigation service.
That's right. So it's just right. This guide model is only designed for traditional Medicare. However, I encourage families who are under Medicare Advantage plans to ask their plan, to ask their providers for this type of care. We need, oftentimes, it's the voices of the families who are living with these diseases that have the strongest influence. And so we really encourage you to ask for this from your providers, from your plans, but also to be eligible, you need a diagnosis of Alzheimer's or another dementia. And I also want to emphasize that there's no cost to you, right? So if you are a caregiver of someone with dementia and you're thinking about whether this is right for you, I want you to know there's no cost to you. So the challenge is just really finding out if there's a provider, a health system, community-based organization that is maybe that's serving your area that you can connect with. And so I'm so glad Monica's going to say a few words about that at some point, because I think that's the challenge, is you just got to figure out where can you get connected to one of these guide programs.
Yeah, and I think you said something really important, Kate. You have to have a diagnosis of Alzheimer's or another form of dementia. And I think, just as a reminder, so many people think that having memory or thinking problems is a normal part of aging, where we know that there are normal changes that happen to our brain as we get older, similar to all of our other parts of our body as we age. But there are warning signs, and the Alzheimer's Association certainly highlights the 10 warning signs. But when you start recognizing memory and thinking changes in yourself or in someone else, encourage them to go to the doctor to get an evaluation to determine the cause of those symptoms. Because if it does end up being Alzheimer's or another form of dementia, how wonderful to be able to potentially access this dementia care navigation service, knowing that you don't have to go through this alone. You actually have all of these comprehensive services that may be available to you to really help you every step of the way throughout your journey. So Paula, very happy to talk with you as a dementia care navigator. You are like in the weeds of supporting families. And so can you talk a little bit about your role as a dementia care navigator?
Yes. Thanks, Monica. So as a care navigator, like I'm dedicated that primary point of contact for those patients and the caregivers, providing personalized support, like every step through their dementia journey. And then just to explain a little bit further, like we help, you know, remove those barriers to care, identify areas where support is needed, help with resource coordination, getting connected to support. And we do that all through a comprehensive intakes and assessments, creating a care plan, building relationships with those patients and those caregivers so we can continue to assist and support them as their needs change, through their whole journey. Our goal is to help them stay happy and healthy and living in their home as long as possible. And as their needs change, we want to be there to support them to make sure that they can do that.
Yeah, I'm glad you said that, Paula, because I know part of the goal of GUIDE is really to reduce caregiver stress and keep the person living with dementia at home for as long as possible and out of a long-term care community, out of the hospital, and out of the emergency room altogether. Paula, can you share, because I want our audience to be able to kind of see how the navigation really comes to life in helping real families. So are there any stories that you can share of how you've been able to personally, as a dementia care navigator, help a family in a specific situation that they encountered and reached out, or you assessed and determined that there was a need that they had?
Yeah, so I do have a patient story that, we did assessment, I meet with this patient, depending on their needs, like I met with them weekly until we kind of got that initial feeling of crisis handled, where they felt they were just at their wits' end and they just didn't know where to turn. But through assessments and a comprehensive intake where I just ask all kinds of questions and figure out what their goals of care are and what their immediate needs are. And my patient, she's a 78-year-old female living on her own. She's got adult children who are sharing the responsibility of caring for her. She's no longer preparing her own meals. She's forgetting to really manage her own medications. The adult children are overwhelmed with the care and the changes in their mom. Stress level is high for everybody. Kids don't know what to do or where to turn, where to get help. Patient is concerned that she's a burden to her children. It's common. We see that all the time. And the kids are exhausted. They're working full time. They're that sandwich generation where they're taking care of their own family and taking care of their parents. And so, their concerns were being left alone for long periods of time. It's hard for them to manage their own time and schedules. They're helping with meals, medication management, transportation to all of their providers. So the goals that were identified were, we need to reduce that caregiver stress and burden. And doing that through obtaining some in-home caregiving, some respite care, and then really educating the kids on the progression of the disease. And let's planning for that future if things were to change and they needed to have more care. So, after meeting, with the family, I was able to get them connected and established with Adult Day Health and get some in-home caregiving. On top of that, being able to be part of GUIDE, getting that respite care, when they do need that additional long time, break, and then really made some recommendations. A voice activated medication dispenser that the kids can record their own voice to say, "Hey, mom, it's time to take your medicine," and she knows that it's time to take her meds. And then something which seems very simple, but a lot of people don't think about, was connecting her Alexa to the cell phone so she can say, "Alexa, call, whoever she needs to call if she needs, help from her kids." We created a visit schedule for her kids so they weren't so overwhelmed, where it was, they kind of knew in advance, this is my day or the time that I'm going to go visit mom. So the other ones didn't feel like they were always burdened as well. And then got the family connected to support groups, a dementia education series that was put on by their county. And really we just keep with ongoing check-ins, reassessing the goals and the needs that the family has, because those will change. And so we just keep checking in. And, right now the family and the patient, they're less stressed and they're thriving.
So this is a question to both of you because I really want to make sure that our listeners and viewers today really understand the comprehensiveness of dementia care navigation. And Paul, I think you did a great job in explaining how you were able to help a family with multiple caregivers, but really understanding that it's not just about giving a referral to the caregiver to say, here's where a resource that we think you need. Now, pick up the phone and make the call and put the services, in place. These navigators are really providing, not just identifying those resources, but helping the family to put them in place. And right, so all of this doesn't fall on the caregiver to have to do, because as you said, Paul, they're working, they're raising children, they have families that they have to take care of, and they're trying to provide good care as well. It's a lot to have to try to put things in place. And it sounds like these navigators can really step in to help do that for the caregiver.
We really become problem solvers and helping the family solve the problems that they have. And sometimes identifying ones that they don't even realize that they have or that are coming up. And so we really do help, connect those families with what they need to and help them navigate that and assist where we can. And really kind of taking them by the hand and being their support system through this journey. It's a hard journey to navigate, and we're just here to really walk them through it.
Now, for both of you, I know that dementia care navigation really doesn't take the place of the primary care physician, right? So I want to make sure that that's very clear. It actually adds another layer of support to that physician who he or she or their team may not have this time that it takes to talk to the family, find out what their needs are, not only immediate, but maybe more long-term, and really help that family put those into place. So can you both talk a little bit about how your programs actually work with the physician, and you're part of that care team in being able to support the family?
Yeah, I can start, Kate. We create a care plan, and we do so with, here at Ripple, we have a care team here too. So we have the nurse practitioners, we have care navigation, we have social workers. So as the care team, we create the care plan based on the needs of the family, the care, the patient, and their preferences. And then we create that care plan, and then we share that care plan with their other providers so that their other providers know what it is that we are working on with this family and what we can do to support that family. And then we also share that care plan with the family. And then we, as a team, if things change or there's things that happen, we loop those other providers in, and we really communicate to work as another layer of support for their patients.
And Kate, that could be really important, right? As you talked about other comorbidities like diabetes, heart disease, the medications, having that line of communication where you have a navigator who can make sure that all of these doctors know what's happening, and how maybe medications are interacting with each other can really be of great value to families. Oh, you're muted. Sorry.
Sorry about that. I had some noisy kids downstairs. So, yes, so often, we hear these stories about how the specialty provider for the patient's heart condition or their, back pain just ignored the dementia. It wasn't part of the care plan, going as so far as to give instructions to just the person with dementia without the family member present, or giving medications that, might be contraindicated given the setting of cognitive impairment, or making decisions about surgeries when really not incorporating the family's goals of care. So it's important that dementia be front and center in all of medical decision-making, and that the different providers involved in the patient's care are communicating together. And the care navigator really provides that coordination, that glue, and make sure that that care plan that Paula mentioned is in the electronic health record in a place where it can be seen. So when that patient shows up at the emergency room sees that care plan. That needs to be front and center in their care.
Yeah, that's the whole purpose around this navigation, right? Is making sure that all of the care team, all of the doctors are really in the know about what's happening so that everyone can make the best decision for the person living with dementia and that caregiver as well. Now, I will say I've heard that when dementia care navigation and even through Guide, Kate, is offered to some families, they may say, you know what, things are okay right now. I'm good. We're good. Especially if someone's in the very early stage of Alzheimer's or another form of dementia. And, maybe they're not dealing with, the challenges that can occur as someone progresses further along. But it's really important, right, that families take advantage of these navigation services, especially under Guide if they're eligible, to receive these navigation services at no cost to them. Can you both talk a little bit about why that's important, not to wait, even if everything seems like it's going okay today? Paula, do you want to start?
Sure. I think it's important to get dementia services as soon as you can, because these things can be really difficult to navigate. And if you can establish dementia care early on, it allows you to be proactive in that planning for the future, planning for the what ifs, really, doing all of this when there is minimal stress and minimal burden. And then your person living with dementia can help be part of this process where they can help make some of the decisions on what they want their care to look like down the road when they can no longer make decisions for themselves. And the dementia, we want the families to be confident in this dementia progression and know what to expect. Make sure there's a plan in place, feel educated on the disease, and that they have an established care team that they can turn to for help that they have already built a relationship with.
Yeah, that's a great point about making sure, especially very early on, in the early stage, where the person living with dementia can talk to the family about their preferences and what they want to see happen as their care continues on and as the disease progresses. And it really can alleviate a lot of the stress for caregivers to question, am I making the right decision? Is this what my mother, my father would have wanted me to do, right? But having those conversations early and often can really help caregivers feel very confident in the medical decisions that they're going to have to make in the future.
Yeah,
Kate,
I'm sorry, Monica.
yeah,
Because grief and guilt play a part into those decision making. So if
right.
you can get those made with your person with living with dementia, it helps with that as well.
Yeah, absolutely. And Kate, that same question to you as far as, maybe some families who say, you know what, I don't feel like I need that navigation service just now. What would you
Yes.
say?
Well, I don't know if I could add too much to Paula's beautiful answer, but I'll just say that the needs in dementia, they change as you go through the disease. And I promise you, if you think you have it figured out now, there will be a point where you don't know what to do or you're faced with a new challenge that you find overwhelming. It happens to every family that's living with dementia. So what a great idea to get your care plan in place during a time when you're not in crisis. I mean, if you are in crisis, you should also go get a team in place. But if you're not in a state of crisis and things feel manageable, get that care plan in place that will help you be proactive and have everything in order so that when a crisis does emerge, you'll be in a better position to handle it. So yeah, I couldn't agree more. Dementia is challenging for every family. I don't think I've ever met a family that went through the stages of dementia and was like, oh, that was easy. That doesn't really happen. So yes, you need support and you deserve support. It's so much easier if you're not doing it alone. And I encourage you to find support from care navigation, but also to, reach out to your network of family and friends for help as well. Don't keep all of those burdens inside. You need to rely on your family, your friends, and hopefully a care navigator in their team as well.
Yeah, a couple things that in hearing both of you speak, first off, that these navigators are not really just focused on the medical component of care. There's also education, support services, right, that families so much need. Also, that we know that Alzheimer's and dementia affects each person differently. No two people go through this experience and the families in exactly the same way. And to your point, Kate, you don't know what you don't know. And, it's better to be proactive than reactive. And making sure that you have this service in place and you have a navigator that you can call if you have questions and you don't know the answer to certain things or you're wondering what's happening because you're starting to notice changes. You're right. Nobody has to go through this alone. And certainly this navigation service is there and it's available. And families really should take advantage if they are eligible for this type of service. Now, I know a question that all of our viewers are asking is, where can I find this wonderful navigation service in my community? And so, as Kate said in the very beginning of our ALZ talks, talk to your doctor. Dementia care navigation is fairly new, especially under the GUIDE program. So, there's going to be some programs, as I said, that just launched this year, July 1st, and there's going to be a lot more that are launching July 1st of 2025. So talk to your doctor. Find out what are they doing around dementia care navigation. Are they part of the GUIDE program? Are they a participant? And they can answer that question for you or at least get the answer for you. You can also go to CMS's website. If you go to cms.gov, at the very top is a search bar. If you type in GUIDE, Guide, it will actually take you to a page that has all the information that you need to know about GUIDE. There's also a participant list. It's an Excel spreadsheet, and you can open that up, download it, save it, print it, and you'll be able to see where all of these dementia care navigation programs are across the country. Just as a reminder, there's some of them that started offering services this year. The majority will start offering dementia care navigation July 1st of 2025. Well, we covered a lot of information, but I want to thank you, Paula and Kate, for this really great conversation. So much information, and I hope that our families learned a lot about dementia care navigation and the GUIDE program, and hopefully get connected to a service in their community so they too can benefit from this wonderful, wonderful service. So thank you both for joining us, and thank everyone in our audience for joining this ALZ Talks. Take care, everyone.